Okay, now let's say a few words about respiratory pathologies, and then we're going to jump to the renal system, okay? I'm going to focus on three. So we've got the respiratory pathology of infectious nature. I'm not going to talk a lot about pneumonia. Okay, I'm going to mention tuberculosis. So it's lower respiratory tract disease. It's a bacterial disease caused by Mycobacterium tuberculosis. Very contagious. Main symptoms of the disease: cough, fever, pretty much low-grade fever, and bloody sputum. It is treatable with antibiotics, but the main problem is that the treatment is very, very long. We're talking about a year of antibiotics, with a often changing course, like you doing this and this, sometimes combinations. The easiest way to diagnose, well, there are plenty of ways to diagnose, but the main sort of sources of tuberculosis here in the United States is a penitentiary system. We're talking jails and prisons. Does that make sense? Because people are crowded usually, and let's be honest, the hygiene, ventilation may not be optimal. We clear? We already discussed obstructive and restrictive respiratory diseases when we were talking about ventilation, so I'm going to skip those. Lung cancer. There are several types of lung cancer. It depends on which cells it arises from. Okay, it can be carcinoma, adenocarcinoma. The main problem, the main risk factor. What is the main risk factor for lung cancer? What is the risk factor? Smoking. Okay. Almost all cases of lung cancer are associated with a history of smoking. The main problem is that it is really hard to detect early. Does that make sense? People with lung cancer often do not know about the diagnosis until it is, too late to treat or operate. The treatments now include various chemotherapies. There are now two drugs, Opdivo and Keytruda, which actually significantly improve the 5-year survival for the patients with lung cancer. So we're talking about people who previously would be given 6 months, now they live 3-4 years after the diagnosis. For cancer, it's enormous success. And finally, cystic fibrosis. So in cystic fibrosis, it's a genetic disorder. As far as I know, it's most common genetic disorder, lethal genetic disorder in the United States. So what happens is that chloride channel is dysfunctional, which results in the increased production of very thick mucus. Does that make sense? Very thick mucus. So far we good? Now the thick mucus blocks the respiratory passages, it blocks passages in the reproductive system, even ducts in the pancreatic pancreatic gland. And the main problem for these folks with cystic fibrosis, is that this thick mucus restricts the breathing, right? And it also provides a good breeding ground for bacteria. So they have recurrent bacterial infections. And since they have to be treated with antibiotics, many of those bacterial infections become antibiotic resistant. And basically people end up with chronic pneumonias, which inevitably sort of result in the early demise. So far, we good? Okay.